afternoon, everybody. Paul Connors is my name, National Director of Communications with HSE. Sean Murphy, for those of you who don't know him, is General Manager of Letterkenny General, and Dr. Paul O'Connor is the Clinical Director of Letterkenny General. So the purpose of the press briefing today is, I suppose, is to try and compartmentalise the work that these two very busy gentlemen are doing on one hand, and on the other hand to try and get you and through you to the public as much information as we can possibly give you at this stage for this very unfortunate situation in the hospital. The intention is that we will hold these press briefings in lieu of interviews, one-to-one interviews, and as you can imagine, we're getting absolutely flooded for these types of interviews right now, and excuse the pun, and the intent is to allow the guys to get on and to try and deal with the situation as quickly as possible. So the intent is that we will have this press briefing today. If there is a significant update between now and tomorrow, we will consider having a press briefing tomorrow. Otherwise, we will have the next press briefing in 48 hours' time. We don't expect that there's going to be a significant change in information between today and 48 hours' time. So I think we don't be wasting everybody's time by coming back in here tomorrow. So I'd ask all of the media outlets that if you can bear with us over this very difficult period, and have an understanding that looking for individual interviews with either Sean or Paul is going to be really, really difficult, and if we can contain it to this. So I'll hand over to Sean, and Sean will just give you a few words by way of an introduction, and then I will take questions from you and pass them on appropriately. Sean.
Good afternoon, everybody. I'd like to start by yet again thanking everybody who rallied to support us with the flooding last Friday evening. Particularly, as I said, our staff who were absolutely tremendous in terms of their commitment and the training they showed in evacuating not just the emergency department, but a coronary care unit and the oncology ward, and relocating all those patients within 90 minutes into safe accommodation without any injury, incident or mishap to either patients or the staff involved. I would also like to thank our colleagues in other agencies who also came to our support, the fire service who were on site in minutes as we're on Garda Síochána, who helped us control the site and arrange services, our colleagues from the County Council, and our troops from Finner Army Camp, who also came and gave us huge assistance. Again, as I've said, local businesses have been absolutely tremendous, not just in the immediate aftermath, but over the last number of days in providing services, goods, equipment. And again, I'd like to thank the local community and a number of volunteers who actually came in and assisted our staff from the public on Friday night. There was a tremendous operation done very effectively, showed the skill and training of our staff, and I would like to thank everybody and those agencies for their commitment and for the efforts they put in. I suppose after the immediate aftermath, we have been so dependent on our colleagues in the ambulance service, in primary care and in community care, in Sligo Hospital and in Donegal Hospital, for the services that they've provided to the people of this county in allowing us to divert work outside the hospital and ensure patients are safely treated in other locations. And they've taken a number of patients to both hospitals. GPs have also treated patients where they can and diverted them to the other hospitals where necessary. And again, that's been a huge asset in terms of ensuring safe patient care during this tremendous challenge for the hospital. So again, I would like to thank all of those, including those staff in the community hospitals who are supplying us with services and also taking our patients and helping ensure that patients who are treated get discharged as promptly as possible in order that we can then make space for the patients that we need to treat. Patient welfare has from the outset been our primary concern, and that continues to be and will continue to be our main concern. So every effort that we make at the moment and everything we do about re-establishing services is always in the context of ensuring that before we re-establish something, it is safe to re-establish that service, and that patient care will not be compromised with any arrangements we put in place. The situation in Letterkenny Hospital remains pretty much as it was last Saturday morning. A large proportion of the hospital has been covered in contaminated flood water. So this isn't just a water problem, it's a contamination problem. So there's a hygiene and infection control issue here. We cannot just clean up the flood water and put patients back into those areas. As I say, it is a large proportion hospital, not just the emergency department and the medical assessment unit, but our radiology department, our pharmacy, our outpatient department, our haematology and ward, and our coronary care unit, our kitchens, and a lot of this support service and office areas and clinic areas are in that environment. So it is a significant proportion of our estate that is currently out of commission. And what we have done is we have relocated services elsewhere in the hospital where appropriate. We have taken services off-site where necessary. And as I said earlier, our colleagues in Donegal and Sligo hospitals particularly are taking emergency patients to assist us and also helping us with arrangements for those emergency services. We've also got support and assistance from colleagues in Galway for urgent surgical cases, and as people know, we are now part of the West Northwest Hospital Group, and I'm indebted to the support we've received from the CEO of that group, Mr. Bill Maher, and the chairman of the group, Mr. Noel Daly. Again, from the outset, the group has rallied around. I don't think they realised that they were what they were taking on when they took on Letterkenny, but they found out very quickly this weekend. We've got catering support from Mayo, we've got clinical capacity in Galway, we've got expertise in areas such as medical physics, clinical engineering, etc. from within the group. So again, fantastic support and very much appreciated. I think that's probably an overview at the moment. As people are aware, there are a number of services that we are continuing to provide in the hospital or on an off-site basis, and we've been issuing those through our press statements. I'm happy to go through in the questions any details on some of that. It might help to put some sort of context in terms of the effect that we're at this stage. We normally see about 1,600 outpatients in a week in the hospital in Letterkenny. We have now made contingency arrangements for about 2/3 of them. Either clinics that we can still run on the hospital campus in areas that were not affected or off-site. We are effectively closed to inpatient admissions except for our maternity unit, and we have some limited paediatric service for paediatric medicine. Sorry, somebody's phone's gone. Our day cases we see about 300. Sorry, okay. Can somebody remind me when the phone rang?
Yeah, you were saying that.
Closed inpatient except for maternity, and some GP referred paediatric cases that do not require radiological investigation. We normally see about 350 day cases in a week, and at the moment 350, and of those a little over 100, about 120 of those are cancer patients on chemotherapy regimes. We have maintained that service. Those patients continue to have their treatment. We haven't interrupted their chemotherapy or compromised their care. That area was not affected by the flood and is continuing to provide the service. The other 200 patients, 230 patients per week are currently postponed, and we will have to reschedule those. We also have about 200 dialysis treatments that we provide per week, and again, those services are continuing, and we're continuing to treat those patients. So as you can see, there's still a substantial amount of work that is ongoing, but there are also very significant constraints on the hospital at the moment. Our single biggest, we have many challenges and we have many constraints. Our single biggest is radiological investigation support, and proper diagnostics is the heart of modern medicine, and Dr. Connor will be able to talk about the importance of that when he's answering questions. We have virtually no radiological capacity as we sit here today. We have some small portable units which function on a case-by-case basis. It is nothing like the high-tech computerized systems that we would normally provide. So it limits us in terms of the range of what we can do and the speed at which we can do it. That said, as I sit here at the moment, there are trucks trundling across Ireland and the UK. I think some coming across the continent. We will have mobile CT and X-ray facilities and on site, hopefully the latter part of this week. We will have mobile MRI shortly thereafter. We have a challenge on top of everything else to locate them, make sure that we have power supplies and systems in place to get patients from the buildings into those trucks, reporting stations set up. There's a huge logistical effort just around getting those operational. So we are making very significant progress to try to re-establish services, but this is going to be a phased basis and it's going to take some time.
Okay, so we'll go into the Q&A session, and if I just ask maybe for 15 minutes or so, and we'll stop at that stage. If you just identify yourself so that we're all clear in terms of who we're talking to and from what media organisation you represent.
Kate, Donegal News. Can you tell me what remedial action was taken after the building was flooded in December 2011?
Okay, there was a range of remedial actions. To be honest with you, at the moment, my focus on the clinical areas, I would want somebody with more technical expertise to be able to address that.
Suffice to say, Kate, that there were remedial actions taken at that point following the last flooding and the centres on the culvert. There is an independent civil engineering review underway at the moment, and until that is completed, we're certainly not going to speculate as regards what has happened, but there were remedial actions taken at that point. And for example, there was a second screen up in that culvert. But aside from that, we're not going to speculate in relation to whether that worked or didn't work. Independent civil engineering will tell us that.
It would appear on the face of it that it didn't work.
Well, you can say that, but until we get our expert analysis back, we're certainly not going to speculate on that. But something didn't work clearly. But we did have unprecedented rainfall as well, and I think that's got to be taken into account as well. Okay, next question. Yeah, yourself.
Eve Blair, Floyd. Obviously you've praised and thanked Donegal Hospital and Sligo Hospital as well for intaking patients. Could you tell me what the situation there is at the moment of the intake of patients to Donegal? We've been hearing reports that non-emergency patients are being turned away. I just wanted to clarify what exactly the situation is.
Our focus, what we've asked Donegal to assist us with is emergency admissions, because we don't have the emergency department in operation. Our colleagues in Donegal are continuing to support us in that regard. Obviously, as the days go on, we refine how we organise this, and what we're working on at the moment is developing clearer protocols to ensure that patients get distributed equally between Donegal and Sligo. So on any given day over any 24-hour period, one hospital does not get overloaded or overloaded with patients. Letterkenny has got the 6th highest level of emergency admissions in the country. It is a busy emergency department. Donegal and Sligo are equally busy departments. You can't take that volume of patients and dump them in one place at one time and expect to ensure good patient care. So what we're doing is working with the ambulance service in Northern Ireland, the ambulance service in the Republic, and our colleagues in those hospitals and the departments of health, and as I said, the colleagues within the West Northwest group, to ensure, first of all, we distribute the patients between those hospitals. We get our services and do what we can to help out as quickly as possible, and that those hospitals are also working, as I say, Sligo with the West Northwest group and Donegal with their trust, to ensure that the hospitals surrounding them can also take some patients. So you have a cascade system, so you don't end up with overloading of one hospital. I don't know if Paul would like to add anything from a clinical perspective.
Yeah, in principle, patients from the south of the catchment population will drain to Sligo, and those from the north will drain to Donegal. It's a slightly fluid situation in terms of a hospital potentially going off call for a couple of hours. This can happen during the normal operation of any hospital, and there may have been individual cases of patients who weren't treated in one or other hospital that I'm not able to comment on at this stage.
Okay.
apparently the Coast Guard helicopter in Sligo is now on 24-hour alert, and they're saying that Sligo is now at the hospital, but there's pressure there already. How long will they have to be covering for Letterkenny, do you think, in Sligo and elsewhere?
Okay. As we sit here at the moment, Eileen, I wouldn't want to start speculating around those timescales. As I said earlier, our single biggest constraint, but not our only, is the radiological diagnostic capacity. We are working to get that established towards the latter part of the week, get that on site by the latter part of the week. As we have it on site, we will be able to carry out further assessments in terms of how quickly we can get it established. My team at the moment is focused on ensuring that when those units roll in, we've got somewhere to put them, and we've already set out issues such as utilities, electrical supply, etc. But we also need to move the emergency department from its current temporary location in the day surgery unit into what used to be the old medical tree ward. You'll be familiar, you were with us when we opened it, and that will become the new emergency department while we refurbish. That's all going to take some time. There's a lot of work to be done on it. We're hoping to have that done as quickly as possible. We're hoping to start the move and have the move completed by the end of this week. The units on site at the end of this week, but I couldn't say when we'll be then in a position to have everything set up within there, the monitors set up, all the technology put in, and the diagnostic units function in order to be able to take patients. When we do, it will be again on a phased basis. We will be ramping up slowly. You cannot take 40% out of a hospital out of commission within 2 hours, in fact within 60 minutes in reality, and then expect to go back and be back at full functionality in a couple of days.
You're talking months then? Consider the length of time.
We're talking months to get everything back as it was. We're talking shorter periods of time to get services re-established, and obviously within that we've got to prioritise which services we can establish. I've already said we are one of the busiest emergency services in the country. Clearly that is our priority, but that cannot work without proper radiological diagnostics. So that is our first step. So you end up having to triage and decide what comes first and get the next step going, while at the same time where there's opportunities to get some services also back up and running, which may be less important but easier to get up and running by sending them to other locations, etc., such as our fracture clinics that are running out of Donegal Community Hospital. And if I start sit here, I'll be here all day thanking the people who are providing us with facilities. I'll go to NowDoc, there is a huge list, and then I'll leave somebody out. But so many agencies are assisting us at the moment. So things we can quickly get set up elsewhere, we will. Our focus on the emergency department, and to get that, we need the diagnostics. So that's today what we are focusing on.
Is it true that there is talk that you may have to knock some of the old building because of contaminated asbestos?
There are ongoing assessments of the damage and what will be needed to put it right. I haven't seen the reports yet, so I can't speculate. It is a 60s building. I'm sure there is asbestos in the area. Whether we're talking about knocking or rebuilding, or what we do know is that the level of contamination has seeped into the fabric of parts of that building, and therefore it is a very major operation to get that back into action.
And will insurance cover it?
Insurance will cover as far as I know at the moment, but as say, Paul and I are focused on the patient care element and the clinical services. I'm leaving the insurance to my colleagues elsewhere in the hospital group and the HSE.
Just on that, and I'm sure lots of you have lots of questions that you'd love to have specific answers on today. We've had a few of them already. This is the first of the briefings, and obviously we're at a very early stage of this process, and more information will come to us as we go through these briefings. As the information comes to us, clearly we will get the information to you and likewise on to the public, because it is important, and that's why it's important that we are here today to give you information, and as updates come to us, we certainly will pass them on to you.
Just for yourself, Sean, there's a lot of talking around and talking to people who are employed in the hospital and I think are genuine fears and maybe unfounded fears about, you were saying a lot of services and stuff are affected obviously because of the fallout. Are there any issues, it's a major employer in the hospital, are there any issues surrounding jobs or people being, put on shorter weeks or anything like that? And there are genuine fears there in catering staff and stuff like that.
No, there are no issues, and I've made that clear to staff, I've made that clear to heads of departments. We have, up to today, we were having 4 times daily heads of department meetings to give people time to do things in between. We've now put that down to 3 times daily. And I've asked the heads of departments to communicate it, I've asked the trade union representatives to communicate to their members, and we're also through email, memos, and as we go around talking to people, reassuring people. We are rebuilding Letterkenny Hospital. We will get the excellent parts of the service back to the condition it was before. We will get the other parts back to an even better condition. We will reinstate our services. In the interim, there's a huge task of work. If you actually send work to be done elsewhere, that is more labour intensive, trying to re-provide services. Fracture Clinic Donegal Town, for instance, a classic case. So the manpower is needed both for the continue providing services and to support the contingency arrangements. It's absolutely essential. There is nobody need fear about their jobs. This is a group of staff that showed what they are made of to the people discounting the country last weekend, and their jobs are not at risk.
Where there have been contingency plans for major emergencies, like plane crash, major train crashes, was there actually a contingency plan in place for the likes of this?
There was a contingency plan in place. As you can imagine, as a hospital, our major incident plan is normally focused on taking casualties into the hospital and treating them. But we always have to prepare for a disastrous situation within the hospital, and we had a contingency plan. Unfortunately, within the contingency plan, the first area to decant the emergency department was the outpatients department. And as the flood waters started to rise, Mr. Jerry Lane, consultant in emergency medicine, and myself went round and inspected the outpatient department to identify that it was secure and that there was no opportunity for water to enter from the rear. The reality was, as we finished that inspection, the waters were already coming through the radiology department, as it was one of the worst hit. And we realised that we would be moving into an area that we probably could not secure, and therefore took the decision to actually abandon that section of for those who know the hospital, the 60s building, and move across the link corridor into the 80s building. So our contingency plan had to be rewritten on the hoof. So I think Jerry says the spare tyre of the car was also gone, so we had to get another spare tyre.
Is that us? So, guys.
Can I just, I've talked a lot about external agencies and our staff, and I could list names all day, but I've mentioned Jerry Lane already. I've Paul's here with me today. Don't want to get a word in edgeways. Can I also talk about Dr. Anne Flood, our Director of Nursing and Midwifery? Our nursing staff is the single biggest workforce. They were absolutely excellent. They have redeployed and they have accommodated. They have been creative. We set up an alternative coronary care unit within minutes. Anne's leadership there has been fantastic. Peter Byrne, our facilities manager, has kept the whole estate working absolutely brilliantly, keeping our utilities and our accommodation restructured. And Paddy Rooney, my deputy, without whom I would have gone demented. So I'd like to thank those.
Sean, on that note, we just ask you how, sorry for just one question. I know you talk the clinical side of stuff and everything, but yourself personally as a manager of the hospital and your staff, can I ask you how this has affected you? This obviously it's one of the biggest challenges in your career.
It probably is. When I have time to stop and think about it, I might be able to answer that question honestly. I suppose, like everything I've said on several occasions, the training of the staff kicked in. I think we all did what is expected of us and what we knew we had to do at the time, and to some extent, I suppose, in the immediate 24 hours, you're on an adrenaline. You then, over the latter part of the weekend, and this is going, and I've had this conversation with so many staff, and as we go around the area, it's a sense of sadness, and it kicks in terms of we see the best facilities in our hospital completely devastated, and we see all the work we've done in terms of continuing, and I will have talked to many of you over the number of years about the development of services in the hospital, and now we see 2/3 and more in some areas of our services that we can't even provide on site. So that becomes quite an emotional, and even as I talk about it, it becomes quite an emotional issue. But stepping back, as I say, our focus now is on going forward, and my honest, absolute belief, and from all the support I've received, not just from it in the hospital group, but from nationally and regionally in the HSE, I have no doubt there's an absolute commitment, and Bill and Noel has been absolutely clear and affirmed the commitment to actually rebuild services. So now we've got to focus on, let's get the services that we need to get up safely and quickly. Let's work on the others, and let's make sure that as we rebuild, what we provide will even be better than some of the services that came out. So look, we're looking to be optimistic, but we're tired.
Okay, so as just reiterate the point about at the start, if we have sufficient information tomorrow, which it seems at this point as if we won't, so tentatively let's look for 48 hours time for a further update. Yeah.
Sorry, could we also just, when you're putting this in, again ask patients to continue to with their patience and cooperation with the restrictions. I think that's important. People have been absolutely great. People's got to have been great, and we just ask that they continue to understand that we're still under a lot of pressure, and if that cooperation and patience could continue, because we will get back to normal as soon as possible.
Maybe just clarify one thing for people. I mean, we're saying out in the Dublin is under pressure now. If somebody has an emergency now and they need to go to an emergency department, where should they go?
The situation is that the ambulances have been instructed to divert to Sligo and Donegal. In the event that the ambulance crew form the opinion that that patient might be unlikely to survive the journey, then that patient will be stabilised in Letterkenny prior to transfer. And in the event that a patient presents to the hospital again with an acute life-threatening emergency, the same applies, so stabilise and transfer.
But if you have an accident at home or something, you know, if you fall off a roof and you're going by car, where do you go?
Well, in the first instance, you go to your local GP or to NODOC, and in the event that it warranted a hospital referral, but it was non-life-threatening, then the ambulance diverts.
Okay, guys, thank you very much for your time, and we'll leave it at that then.